their transparency in the model. I think clinicians, particularly, are now looking for that explainability. So if they're using any of these models, they want to know, why did that come to that decision? Because we're entering this sphere now where, as somebody who actually applies this in practice, there's a lot more ethical dilemmas, about using the model. If the model tells me this is the output, and I agree with that, am I the one who is liable for if the model was wrong? But what I would like from the model as a clinician is actually know, why did it come to that decision? So you want to know that, if it's explainable, that's really helpful. We know a lot of the technologies that underpin, especially LLMs, underpin some of these new technologies coming through in MedTech. Sometimes it's not possible to come to that decision, which is difficult. Also, we need to think about the landscape of AI deployment. So really important in terms of like post-market surveillance as well. So at the moment, I've seen a lot of AI being deployed in great tertiary centres in the UK, and that's also where I thought that AI was going to sort of narrow health inequality. Perhaps at the moment we're seeing it more concentrated in centres that are doing superbly well. But also, how do we deploy that from a clinical application point of view in these other smaller hospitals across the UK? And that's really challenging because it's going back to my sort of personal interest,